It's Dr. Andy. I'm here at the Great Lakes Health and Wellness Ohio City location. I'm with one of our practice members, Mary, and we're going to take you through a typical flow, a typical visit of what we've been doing with Mary and how we've been helping her out. She's getting a lot of achiness in her upper back, a lot of tension in her neck. She's also experiencing some mid and lower back pain, some sharp pain in her hips. She's noticing she can get some temporary headaches at times because she's really tense. So we like to make sure that the spine is safe to adjust. And then we use your x-rays to base your care on specifically what needs to be corrected. So we're gonna start by feeling her mid and her upper back, her thoracic spine. That's where she's getting most of her complaints. I'm gonna wanna start right below that band of muscle fibers between her shoulder blades. So I'm gonna have you go ahead and take a deep breath in. Let it all the way out. Wonderful. So you can see with that force, it's opening her shoulders, opening her chest, kind of negating what she's doing every day and providing the opposite, giving her that ease. We notice that her right leg is shorter, her right hip is lifting off the table, and most of her pressure is on her left side. All this tension's here, it's pulling everything over this way, giving her the issues in the left hip. We're going to want to do the opposite and open it up towards the right. So we provide the subtle rotation in the lumbar spine, provide a little bit of rotation in the pelvis, and we're going to follow through just like that. That was awesome. This adjustment is what we call an anterior dorsal. It's my favorite because I call it the hug adjustment. So I get to provide a hug to my patient. So we'll show you how it's done. Wonderful. So we typically finish the full spine adjustments with the cervical spine. So the bone on the left, we want to move it to the right. And so I'm going to make sure she's relaxed by keeping her head on the table. I follow through the adjustment just like that.
After the adjustments, I feel a lot more relaxed. There's a lot less tension in those areas Dr. Andy has mentioned, and I know I've had a lot of buildup from the years that I've been doing telehealth and sitting a lot, so I'm finding a lot of relief with these appointments that I'm having and looking forward to seeing the long-term effects that our treatment plan gives me.
So a quick little intro with Mary. She's a mental health practitioner, so she spends a lot of time sitting at her chair, hunched over her computer in what we would call this flex position. So we're going to take that into consideration as we do her full spine analysis. If you are into mental health, you develop a deep connection with your clients and your patients. So a lot of times stress and anxiety can manifest in the shoulders, the mid-back, the trapezius muscles. So the first thing I'm noticing is a bigger ball of tension in that mid thoracic spine, and you might even be able to see it with where you guys are. We don't want too many contours with the spine, and you can see this ball of this rounded musculature, and you can even see she needed to relax. She is even tense, so that is why I have my patients relax. So we're gonna start by feeling her mid and her upper back, her thoracic spine. That's where she's getting most of her complaints. So what I wanna see is when I push on her, at least her mid and upper thoracic spine, her head and her neck should extend slightly. It should lift off the table. That tells me that there is a connection between her thoracic and her cervical spine, and that's what we want. We want everything to be nice and smoothly connected. But as I'm pushing through here, what I'm feeling is a little bit of resistance. So there's these bands of muscle fibers that are almost pushing back into my hand. And so we're absolutely going to want to get her upper thoracic spine mobilized and adjusted. And if you can think of how we do that, so we do a prone thoracic. It's going to promote extension. She's spending all of her days at work hunched over, talking to her clients, doing telehealth. So if we can promote extension, that's going to provide a little bit more ease into her entire system so that her body can just start to recover naturally on its own. Wonderful. So you can see with that force, it's opening her shoulders, opening her chest, kind of negating what she's doing every day and providing the opposite, giving her that ease. So still, we're gonna notice that hyperkyphotic upper back, that's why she's here. But now we're gonna start to see some differences in her hips. So we notice that her right leg is shorter, her right hip is lifting off the table, and most of her pressure is on her left side. And so what we want to do is provide her system with ease. I've said that a few times. And so if all this tension's here, it's pulling everything over this way, giving her the issues in the left hip, we're going to want to do the opposite and open it up towards the right. So Mary, go ahead and lay on your left side with your right side up. Okay, so what we're gonna do is start to rotate her pelvis and her lumbar spine back this way. What we saw it was doing the opposite. So we're gonna bend her top knee, and then her foot's just gonna rest behind her lower knee. And when we adjust the spine, we want the spine to be relaxed. If you're resisting us, your nervous system's also going to resist the correction. So we're going to try to get her as comfortable as possible before her adjustment. So we want the head nice and easy on the middle of the headrest. We want her back to be a little bit more flat like that so she can relax. And we're not going to want to twist her like a rag. So we provide the subtle rotation in the lumbar spine, provide a little bit of rotation in the pelvis, and we're going to follow through just like that. That was awesome. We had previously adjusted the upper thoracic spine. Now we want to focus more on the mid to lower. So this adjustment is what we call an anterior dorsal. It's my favorite because I call it the hug adjustment. So I get to provide a hug to my patient. So we'll show you how it's done. So give yourself a hug, Mary. And I like to have the arms crossed one over the other. That way it's just nice and relaxed and stacked. So we roll her this way. And what's really nice about this adjustment is there's a lot less tension created as we sink into it. So as I provide my body weight onto my contact, she has no option but to extend backwards into the table. So go ahead and just take a deep breath in, slowly let it out, and I want you to tuck your chin to your chest. Wonderful. And relax. So we typically finish the full spine adjustments with the cervical spine. We want to be the most relaxed, so lying on your back, face up, palms to the air. That's when your nervous system is at most ease. And so what I'm doing is just feeling each of her cervical vertebrae, and I'm just testing to see if the bones are out of place. There's not a lot of tissue between me and her spine, so these are the easiest to feel the alignment. And what I feel in her is this left atlas, her first vertebrae in her neck. It almost feels like it's rotated to her left. I can actually feel the bone sticking more towards me, and sometimes they might even agree it's a little bit tender on that spot. Most chiropractors believe the atlas is the most important vertebrae in the neck, and so sometimes they focus their practice entirely on this vertebrae, but we are full spine. We like to address the entire system and not just the upper. So C1, atlas, it surrounds the brain stem. It has a lot of neurological input. And so what we're going to do is try to get this bone realigned, but we're also going to keep in mind that she needs extension. So what we're going to do is lower the headrest a few degrees. That's going to provide more of the extension that she needs. And remember, we don't want to have any irritation in the system. We want her to be fully at rest when we provide the correction. So the bone on the left, we want to move it to the right. And so I'm going to make sure she's relaxed by keeping her head on the table. I follow through the adjustment just like that. And again, providing that extension that she is lacking on a day-to-day basis.